Hello, Melamed community. We are so happy to be back with Don't Let the White Coat Fool You. I am Dr. Norma Mobley, here with my dear friend,
Dr. Sharon Dixon.
and we're so happy to be back. As I said, we celebrated and we want to thank you, all of you who liked and subscribed in the past. We celebrated 100 subscribers a few months ago, and we'd like for you to continue doing so.
Yes, please share with your friends. We'd love to have conversation with you and to share in your world as you share in ours. So, what are we talking about today?
What are we going to talk about, girl?
Listen, we're in 2026 and we need to talk about where Black women physicians are. And we're going to talk about these barriers that we're going to be breaking in 2026 because Black women are still the foundation of just about everything that goes on. And of course, in medicine, we believe that's so.
Absolutely. Women of color in general.
Absolutely. So I really wanted to start off just by talking a little bit about what we know. We know that there were over 350,000 Black women who lost their jobs in 2025. And
Right.
I'm sure we are seeing the fallout of that. We know that Black women tend to be leaders in their families,
Right.
many of them supporting their families. So when Black women are down,
The whole family and the community also go down.
and not only in their everyday lives, but of course in their health.
Mm-hmm.
And we're concerned about that because if a Black mother is trying to find other ways to feed and support her family, then sometimes that ability to think about, I need to take my child to the doctor or myself to the doctor, that falls to the wayside.
Right.
Yeah.
It does. And you had an opportunity previously to talk about the Affordable Care Act and what was going on with the subsidies. And we do know that our legislators did go on break before finalizing that situation.
Right, and now I'm hoping something has happened by now. We don't know
Right.
what the results are. We know there was a new health care plan placed out by the Republicans.
Correct.
But I didn't see anything in it that made me feel comfortable about where we are. And for us as pediatricians, we're always worried about the children.
Absolutely.
Yeah. So when mom is trying to get a new job or a couple of new jobs or try to figure out how to pay the rent or how to take care of the kids' school clothing, health tends to take a backstage.
Right.
Yeah.
Yeah. I mean, the paramount things are food and shelter. So healthcare doesn't really kind of hit that light bulb until someone actually becomes ill.
Absolutely. And, it kind of still puts a spotlight on why it's going to be so important for us as medical professionals to continue to do our work well and to help others think about joining us
That's right.
in this field.
That's right.
Yeah. We tend to, I think more about the social implications of health or on health than maybe other professionals might. And so that conversation happens when we're talking. And I know it does when I'm in a healthcare setting. I'm not only talking about your child's attention deficit disorder, but I'm talking about what may be causing that.
That's right. We call those the social determinants of health.
Yes.
And there can be various avenues of trauma that can be encountered or experienced with our patients, not upon them, but through their primary caretakers. And if that person is their mom, then those stressors spill over onto the child.
Absolutely, absolutely. And so it's important to recognize those, right? And if we have lowered the number of Black professionals, and especially Black female professionals in our field, then the ability to recognize where those social determinants of health
Also
intersect.
decrease.
Yes, also decrease. So we are fully committed to helping those who are thinking about joining us in the medical field to do so,
That's right.
helping those who are already here to stay here, you know, and those like ourselves who are on the other end of our careers. I guess it doesn't mean our careers are over, but
Not
we're on the
over,
other
but
end.
we're getting to the other side of trying to see what's going to be next.
Right.
And so as people in our stage are trying to figure out what's next, we need to be taking the hand of those who are coming along and helping to guide them through. And so we'd like to establish a pipeline of mentorship.
Yep. We're excited about that, y'all. Yes, we're going to get started with a mentoring.
A mentoring matchup.
Yes, mentoring
So
matchup.
please stay tuned because that will be coming up soon.
Yes. So as we do that, though, keeping in mind what we can all bring to the table to ensure that our women in medicine continue to thrive is important, because we know there have been so many milestones that have been reached because of Black women in medicine. So whether it's from creating heart valves or
Right.
creating the internet system that we need to do this AI.
That's
stuff.
right.
So many things are based on the knowledge and the
creativity
of Black women.
That's right.
Right? So I'm excited about where we are. I know there are more Black women out there with the great ideas and the number one thing that's going to move us forward in the next few years. And so knowing that, we want to be a part of supporting those efforts and embracing what all we can do together.
That's right.
Yeah. So as we look forward, help us out. Give us some ideas of what we can do together as Black women of Melamed and in this space where we call "Don't Let the White Coat Fool You," because we know Black women have the answers.
We know. And guess what? We also know what it feels like just to be out there and experiencing some of these stressors that many of you are experiencing.
Yeah, so together we're going to make 2026 powerful. We're looking forward to working with you. We're looking forward to you sharing ideas that we can bring to the table to discuss and how we really help move this movement.
This is a movement. We want to be in a partnership to continue our progression.
And we have so much to do in healthcare that some of those women who have lost their jobs in certain other spaces, think about this space. Medicine has so much to offer, and it's a space that needs you.
Definitely needs you. We need you to fill our shoes as we tiptoe to the other side, and our community needs you as well.
All righty. Until next time, we'll see you.
Bye.